A report from the CDC says cases of a new COVID variant has tripled, actually tripled in 2 weeks. Variant BA286, also known as Parola, has been called by a variant of interest by the World Health Organization after comprising between 5 and 15% of all infections that are going on right now. And joining us to talk about this and so much more for some other health topics, Dr. Bill Hartman. He is the principal investigator for UW COVID-19 Convalescent Plasma Program. Thank you so much for being here. We have so much to get to. I'm just going to jump right in. When we talk about these variants with COVID, we heard that they may keep spreading out and going in different directions. These sound really ominous, really scary. Break down exactly what's happening here with us.
Right, and Parola, it seems to be the one that we've been most nervous about, and we've been surveying for quite some time. The reason is that the spike protein has over 35 mutations in it, and so we thought it was going to be quite evasive of the immunity that we've gotten through our vaccines and through previous infections. But fortunately, it does seem that most people have very good immunity still, even against the Parola variant. This is particularly seen with the booster vaccines that have just been made available to everybody. These booster vaccines induce an antibody immunity that is very effective in keeping you from having bad symptoms, from being hospitalized, and especially from the worst things that can happen from COVID.
Another question, if you are going in for that boost, some places are only offering Moderna. Maybe you've had Pfizer before, you don't want to mix it up. How important is it to stay within that same pharmaceutical company, or can we branch out and go, say, to another different company?
So it's actually pretty safe to branch out and try different ones if there isn't one available in your area that you've had previously. And even Novavax, which is a different type of a vaccine than both Moderna and Pfizer, is one that people have actually waited for and gone out and get, just so they can get a different type of immunity than what they had before.
Before we jump in more to RSV, if you're getting some of those symptoms, you don't know if it's a cold, you don't know if you have COVID, RSV, and you take those tests, can they differentiate between the two? How do you know what's going on?
Well, it's difficult to differentiate between COVID and RSV without taking specific tests for both. And so the easiest one to get a hold of at this point is the over-the-counter COVID test. So if you have symptoms, if you have a runny nose, if you have a fever, if you're feeling kind of crummy, or if you've been exposed to people with COVID, just go ahead and get one of those tests. They are available for free through the government right now. But get one of those tests, try it. See if you come up positive. If you come up negative, then go to urgent care and see if you can get a test for RSV or influenza.
Okay, and last question, then explain exactly maybe some of the symptoms of RSV and who should be looking at getting a shot for that. Is it just the young and the old, or are there other age groups that can be considered with that?
Well, RSV it has symptoms similar to COVID. You get the fever, you get a cough, you get a pneumonia in some cases. Anybody can get RSV, but the ones that we worry about the most are the ones who haven't been exposed to RSV before, are very young, or the people who have had waning immunity because of their age, so the people over 60. Other people to consider getting the vaccine, the RSV vaccine, would be people who live with these people, so that you don't spread RSV onto your young child or to your elderly parents.
Okay, great. Well, you've cleared a lot up today, so thank you for dispelling it. It's a daunting time with all these variants and all these different things going on, so we really appreciate it, especially ahead of the holidays. So, Dr. Hartman, thanks for being here today.
Thank you.